Welcome back to the Pharma Forum podcast. In this episode, I speak with Carolyn Ward of Particle Health Inc. about the use of clinical electronic health record, or EHR, data in promoting and achieving value-based care. Providing insightful commentary on the space at the moment, comparing the possibilities and ameliorations with what has gone before and is yet extant, Carolyn explains that the tide is turning in healthcare and practicality and specificity must become foremost, and technology is the way to enact that. From hospitals to pharmacies, Carolyn dives into why the whole person-patient profile is critical for optimum healthcare today, particularly with a burgeoning population. And it can't be done without data. Tune in, let us know your thoughts, and as ever, thank you for listening. This is web editor Nicole Raleigh, and with me is Carolyn Ward, Director of Clinical Strategy at Particle Health Inc. Today, we'll be discussing the use of clinical electronic health record, or EHR data, in promoting and achieving value-based care. Welcome, Carolyn.
Thanks for having me.
So, Particle Health is a data transformation platform for healthcare, enabling organizations across the care continuum to turn medical records into actionable insights. It manages risk, informs treatment pathways, and closes critical gaps in care. This includes readmission prevention through the use of real-time data, as well as referral management and patient risk stratification. Value-based care is at the center of industry discussions at the moment. According to the American College of Healthcare Executives, value-based care, or VBC as it's also known, not only advances quality and equity in healthcare, but it accelerates innovation in care delivery as well, rewarding preventative care and effective management of chronic conditions by tying hospital and clinician reimbursement to patient outcomes. However, before we get into the finer details of value-based care innovation and strategies and technologies for empowerment there, Carolyn, perhaps you could tell listeners a little bit more about you, about the path to doing what you do today with Particle Health.
Absolutely, I would love to. So, as you know, my name is Carolyn Ward. I am an internal medicine physician. So I did all of my training in the United States, New Jersey. And worked at an academic hospital there, and ended up taking a job after that as an outpatient primary care physician focused on preventive medicine at a health tech startup called Forward. And it was during my 3 years there that I was able to speak with a lot of patients who were really looking to be proactive about their health, focus on preventive measures, and understand their own healthcare data in a way that would inform them on what it is that they needed to do to live their best life. And one of the things that I saw in particular there was that our health system is pretty fragmented. So people might go to a primary care physician in one health system and a specialist in another health system. Even if it's these groups that are kind of glommed together, they might be using separate EHR instances. And so the data actually is not transferring between those two groups. The vast majority of physicians still communicate to each other about patients via fax machines. So it's very long. You have to decide, I need to go call an office, ask them to fax over a record. I've got to wait for the fax to come through. That fax has to get scanned into my computer as a PDF. And usually they don't really have the time to say, okay, I know you want exactly this one piece of information. So they're just going to print out and send to you the entire patient chart that they know of, which is like 200 pages long. And I now have no time to flip through a 200-page PDF to look for the one piece of information I'm looking for, right? And so, especially with the advent of telehealth, digital health companies, where a lot of them are much more consumer-facing, and patients have much more say in where and how they want to access care. Now we're generating healthcare data all over the place. And it's really hard, especially in primary care, where you're supposed to be taking care of the whole patient, seeing the whole picture, pulling all these pieces together to make an informed care, a holistic care plan for this patient. It's really hard even to gather the data, much less make sense of it. And it particularly in value-based care, where you might be taking on risk of what's going to happen to that patient. And so that was kind of my journey of like practicing medicine in an academic setting, in a community hospital, and then even at a health tech company, where I started realizing that a huge barrier here was the data itself, how we access it, how we aggregate it, and then how we make sense of it. It's how I found myself as the director of clinical strategy at Particle Health, where I essentially am working with our build teams to understand the use cases and clinical workflows for this clinical data, and then build data schemas and data analytic products that will pull together the necessary data elements for a certain treatment decision, for identifying care gaps, for understanding how you would stratify the risk of a certain patient. And we're able to do that by connecting into the national networks and pulling down all of this EHR data for patients, putting it all together, cleaning it, deduplicating it, transforming it, and then creating a nice analytic package. So that's what I'm currently working on now. It's been a fantastic journey, a very challenging problem, but anything worth doing is challenging.
Absolutely. I entirely agree with that last statement, but let's just sort of go back for a second and note how passionate you are. Your passion clearly comes across when it comes to the area of value-based care. And part of that passion is this understanding, as you say, of how to transition a practice from fee-for-service to a value-based care contract. So I was just wondering if you could tell us more about that transitioning.
Absolutely. Like the intro that you gave, fee-for-service is where most of our healthcare contracts are today in the United States, which is really incentivizing volume. So you get paid for doing a particular action, which isn't necessarily a bad thing, but it does incentivize you to do more and more actions, which may not be needed. The idea of value-based care is to tie financial incentives to the quality or the outcome of the care that you are giving. And what we're finding is there's quite a spectrum of value-based care, right? We have contracts where maybe you're still fee for service, but you have something built in with the payer of like showing some quality measures. You have to hit certain marks to get bonuses, all the way to the other end of the spectrum where you're fully at risk. And if there are bad patient outcomes in your patient population, you as the organization are actually eating that cost. And so especially on that far end of the spectrum, what you really need to be able to do is understand everything that is happening to your patient within the entire healthcare ecosystem. So whether that means that they're going to a hospital, they're going to urgent care, they are having a virtual visit with a telehealth company, they are seeing a specialist, they didn't see the specialist that you asked them to see, they didn't get their blood work done, right? Like you have to really understand that holistic picture in order to say, hey, I understand what is likely going to happen to this patient, and I can intervene in these very specific ways. When you think about an entire population of people that are being cared for by a singular healthcare organization, there's never quite enough resources to go around, right? So organizations need to understand who's highest risk, who's most likely to go to the hospital, who's most likely to have a complication, who's most likely to develop a new disease, so that they can really try and target those folks. That, again, is truly based on having a complete picture of all the data that patient is generating so that you can understand that. A lot of these like models of risk right now are relatively primitive. Some of them are just from the actual physician brains of you're seeing a patient, you're looking at their data, and you're coming up with some estimate of what you think will happen. But as we start to get more sophisticated in gathering this data and having access to it for healthcare providers who are making treatment decisions for patients, you can clearly see a world where you can now bring in data science, you can bring in AI, machine learning to be able to create predictive models to help these value-based care companies be able to understand the risk that they are taking on in an individual patient and at a population level so that they can be successful in their at-risk contracts.
Thank you for that. I just want to sort of, I don't suppose, temper the enthusiasm for this at the moment, because there is also this concern, isn't there, that value-based care might stifle the innovation it's intended to drive, rewarding the use of evidence-based solutions with proven track records, which is quite an issue for a lot of advancing technologies at the moment. So I just wondered what your thoughts were on that.
That is a great question. It's not one that I hear very often, but I think it's a great point to make. Now, on the one hand, I will also temper this by saying I actually think that you can actually achieve quite a bit of success in healthcare by just executing well on the things that are proven. That in and of itself is already very hard to do, and many places can't do it well because of resources, organizational processes, operational workflows that are inefficient. But if you can execute on things that are already evidence-based, which I agree is the vast foundation of value-based care, you actually very likely will provide high value, low cost care for patients. And being able to do that is very difficult. And I think that we can help people to leverage data in order to do that well. That being said, one of the great tenets of value-based care is that it's really about patient outcomes, right? And that's defined by utilization costs. It's also defined by quality of life, right? Are you extending somebody's life? Are you preventing them from getting a comorbidity? And there are certainly a ton of ways that we can push on being able to do that outside of systems that exist today. And so we actually are seeing a lot of that now in research of how people are applying healthcare AI, how they're using LLMs, how they're training machine learning models. Like there is a lot, I think, on that forefront that is still primarily, I would say, in the research and testing phase today in the industry. But we do see a lot of enthusiasm still in that area. And my hope is that as we are learning and developing, we'll be able to speed the transition of bringing those things from research into practice.
Thank you again for that. So sorry, my brain is going back again to what you were saying earlier, and you were mentioning the bringing in of AI for predictive models, and what you were just saying there about the focus on the hows, as it were, of use and training of these technologies. Given the role that data can play, I was wondering if you could also comment on the issue of the ethics of AI use in health data management.
Absolutely. So there's obviously a lot of different ways that people are hoping to use AI in healthcare data. In data management in particular, what I would say is that we all know that healthcare data is extremely messy. All of these different EHR systems have different templates of how they copy in information. When they spit that information out, all the outputs look different for labs and medications. And so being able to pull that together, we certainly can and do use AI systems in healthcare today to try to clean that data up, right? Whether that's using natural language processing to pull out physician notes, whether that is using an intelligent system to be able to normalize the data codes that we're seeing. And I think that there is certainly a lot there. One of the things we always have to be really careful about is, I would say two things. Number one is data privacy and security. So making sure that, especially as we are transforming the data in any way, we are making sure that it is secure, it is private, you have all of those security measures in place. And then number two is the data integrity, right? I think it's very easy to start to say, well, I think that this probably means this, which probably means this. And the next thing you know, you're like 3 degrees removed from what the physician actually meant when they wrote that. And that I think is a very important thing to keep in mind of like not introducing those type of biases into the interpretation of that data when we put that interpretation onto a AI model as opposed to an actual person. There's a ton of research, again, going into this area, which I think is really important. The other thing I'll mention is that a lot of people are using this data that we've generated across EHRs and in research to create predictive models. One of the things we know in healthcare research is that a lot of studies, especially historic studies, have biases in them, right? So maybe your patient population wasn't diverse enough, right? So like we know, 40, 50 years ago, a lot of those studies were done on white males. We don't necessarily know whether or not those research results are now generalizable to the rest of the public. And one of the things with AI, of course, is you are creating training sets for your model from historic things that exist today. So those same biases are likely to be amplified moving forward if we're not careful about watching out for that. So I know that that's definitely a concern and something we think very deeply about as well in the healthcare industry.
Absolutely. So if we think about use cases, can you provide any specific ones? Maybe also sort of branching out to the medication or within the setting of pharmacies, perhaps?
Absolutely. So, I think that one really interesting movement we are seeing here in the United States is that a lot of pharmacies are starting to get into value-based care, meaning they are starting to have to report quality measures on medication contraindications. Did you dispense medication that somebody actually shouldn't have taken? Did you double dispense something? And even dipping their toes into understanding more preventive measures. Like a patient goes to the pharmacy to pick up a medication. Could you also give them their flu shot that they're overdue for at the same time? And so in order to do that, pharmacists who predominantly have only ever had access to a somewhat limited amount of medication data for a patient, they actually now need a much more comprehensive understanding of like, what are this patient's medical conditions? What are their allergies? What other medications are they being prescribed outside of my pharmacy, so that I know whether or not there's a contraindication or some kind of relationship between these medications. And then, of course, they have their traditional, like, is the patient taking their medication? Are they coming to pick it up on time? Did they get their refill for compliance reasons? And so what we are actually now seeing is that a lot of pharmacies are starting to request this kind of patient data so that they can now come in and say, okay, Particle Health, you've pulled this patient record for me. The pharmacist is going to go in and we're going to pull out all of the patient's diagnoses. We're going to pull out all of their prescribed medications, regardless of whether or not it went to your pharmacy. We're going to pull out their allergies, and you're going to be able to take that data and say, okay, I think that this is a safe medication regimen. Yes, I agree. We're also going to be able to pull out preventative measures for you, like, is this person overdue for a vaccination? Are they overdue for a cholesterol exam? So that we can try to start to leverage some of these other healthcare providers in these different actions to help prevent things from happening to folks. And I think a big push of this is the fact that we just don't have enough healthcare providers in the United States to care for our burgeoning population. And so we are starting to see that, traditionally things that may have been done by a primary care physician are being pushed to physician assistants, to nurse practitioners, and now also to pharmacists. And what that means is that these people are going to have to start to develop a clinical context for each of the patients that they see.
Thank you. Yes, this is something that's also happening in the United Kingdom at the moment. So going back to specifically the type of work that Particle Health does, where do you see current endeavors like Particle Health undertakes in this space leading to in the future, say 5 or 10 years' time?
Yeah, absolutely. So currently Particle Health actually started a few years ago as a data aggregator, meaning we're just trying to collect this patient data, put it together, and pass it on as a full package to our downstream customers and providers. What we've realized is that's just a lot of information. And as a physician, I would never want to have the responsibility of reviewing 20 years worth of history on a patient. And so sometimes it's too much information. You might as well have no information, right? Because it's not usable. And so currently today, we've pivoted to becoming a true data platform where we are ingesting that same longitudinal history and deduplicating it, streamlining it, and providing it in a way that gives a true clinical context for quick decision making. We also want to service customers who are enabling those providers. So people who want to create analytics for these providers for value-based care. And that means that you have to have really clean data. You need to have data schemas for certain use cases. And we're building some of that ourselves as well. So that's kind of where we're starting. I would say 5 to 10 years from now, what I would love to be able to do and see is essentially like creating risk predictive models, meaning we take in all this information about Carolyn Ward, and that's not necessarily going to be just clinical EHR data, right? It's probably in the future going to be all the other piece of data that I am generating that we know impact your health. Where I work, where I live, what I eat, how sedentary am I, right? All of my connected devices, my Fitbit, my Apple Watch, and taking all that data and then being able to create a digital twin of Carolyn and saying, hey, if we left Carolyn alone and just left her to her own devices, the way she's acting in the world today, what's likely to happen to Carolyn? What kind of diseases is she likely to develop, right? What symptoms or complications, how likely is she to be hospitalized, right? How likely is she to develop something acute? And then we can start to create models where we can run simulations and say, okay, Carolyn has high cholesterol. If we intervene today with a medication, with some diet changes, right? And we're able to bring it down to a normal range, what does that do to Carolyn's outcomes now? And I think this will be really powerful in 2 ways. Number one is I think it'll allow physicians to be really specific about the actions that they take and understand what the actual outcomes are. And then number two, I think this will be really empowering for patients because today, a patient comes in, they're like, I want to lose weight. I'm like, great, diet and exercise. Their next question to me is like, yes, but what diet, right? What exercise? How much? And I want to know specific to me, not to the general public, walk 10,000 steps a day and eat a Mediterranean diet, but specifically to me, what are the changes I can make and how is that going to impact my health? For a lot of these chronic issues, it's hard for us as humans to make these huge changes in our life when we don't really know what that end outcome is going to be. It doesn't feel tangible. And I think that having these kind of predictive models will make patients feel more empowered to understand how decisions they make today in their life will impact their long-term outcomes.
Absolutely. Yes, as you say, it's this crucial focus of understanding, coming away from the probabilities, going towards the more specifically predictive, the preventative, and the personalized, and empowering the patient. Thank you, Carolyn. It's been a pleasure.
Thank you.
And so that concludes another episode of the Pharma Forum podcast. You can find more information about this episode, including a download link and information about previous installments at pharmaforum.com/podcasts. The Pharma Forum podcast is also available on iTunes, Spotify, Amazon Music, Podbean, and pretty much wherever you get your other podcasts. Just search for Pharma Forum and press subscribe. Of course, don't forget to visit our website itself, where you can sign up for daily and weekly news and analysis bulletins. And do follow us as well on X or Twitter and LinkedIn at Pharma Forum. That's all for now. Thank you for listening.